Why is the Livy Method successful? Does it actually work? How does it work? Does it work for maintenance? These are all questions that my guest today, Dr. Ruth Kane, is uncovering over the last couple of years. Today, she's here to share what she has found through her research of the Livy Method, focusing on the weight loss program and then now on the maintenance program. For the thousands of new members that we have that aren't familiar with you, maybe just a bit about your experience with the Livy Method, your background professionally, and then maybe why you decided to study the Livy Method.
So I'm Ruth Kane. I'm a professor at the University of Ottawa. This research is the most fun research I've done the whole time, and hopefully, potentially the most impactful. So I enjoy it and my team really enjoys it. I happened to stumble upon the Livy Method just like most people through seeing a friend or a colleague. And I noticed a colleague had changed, and I told her she was looking amazing and what was happening, and she introduced me to this. I was very successful over 3 sessions. I lost 70 pounds. Haven't looked back since, but during that time, you were just hiring. You were posting to hire people, and I wrote to you and asked you whether I didn't want a position, I didn't want a job, I had a job, but would you be willing to let me research the program? So I did that for a couple of years on my own and grateful for access. We designed surveys and we had focus groups. And then we put in a funding bid and we got funded by the Social Sciences and Humanities Council of Canada to research it, mainly as an online learning community support program. So we've brought on research assistants from psychology and health studies to help us actually delve back down into the weight loss itself. And we've discovered lots of stuff and lots of good stuff, but also some challenges. I must admit, there's always challenges, but we've got an awful lot of very, very positive data. And so that's sort of how I got into it and why I'm still passionate about it. It is transformational in terms of health. I don't really care what the number on the scale says anymore. But because I lost that 70 pounds, I stopped using a sleep apnea machine. I stopped all blood pressure medication that I'd been on since I was 35 years old, and I'm now 67. So I lost my weight in my 60s after being what many of your members are, a cyclical dieter, never eating till 2:00 in the afternoon, things like that.
What makes the Livy Method different than any other diet? Let me ask you that.
Well, there's an article that we're just about to send to publication called An Education, a Community of Practice. There's a way of learning in situation, learning on the job that is unique. It's different from learning at school. And your group runs as a community of practice because it's like there's people on the periphery who are the new members, and they come in and you've used this term in the maintenance, they're testing the waters, they're checking you out, they're checking the scene out. Maybe they don't ask any questions, but they sit around the edges and they listen to other people's questions and they watch and they watch and they watch and they read the resources. And gradually, if you imagine a group, a circle, they get more confident and move towards the center where they may ask questions. What you've done as the person creating this community of practice is you've put together experts, but you've curated a range of resources. Experts are one resource, that's the medical practitioners, the naturopath, Dr. Paul, etc., Dr. Beverly, the hormone experts. That's one resource. All your posts are another resource. So they're all written posts. Your staff are a resource. They're an expertise level who have lived the program. And so you've connected all these people in this intricate intricate sort of web where we can engage with these resources at our own pace, at our own convenience. We can cycle back and recheck a post. We can listen to podcasts. And that's the way a community of practice works. But the thing about a community of practice, it's not about losing weight. It's about learning. We, as a member, I have the opportunity to interact with others going through the same learning experience. Some of them are more experienced than I am, and so I can learn from their modeling, from their experiences. But we also learn from each other at our own levels of membership. And we interact with the resources that you've curated, this whole suite of different ways of engaging with new knowledge and new experience. And it fits the model of a community of practice just perfectly, which is about learning, but it's about practice. It's not just cognitive learning. It's not just learning and memorizing facts. It's about learning that you turn into practice. So the practice is the understanding the richness of food, understanding how to know when we're satisfied, and putting that into practice. This is why, as an educator, it's so exciting, because you see the evolution of your program becoming something that is such a complex resource for people. But the beauty of it, in some ways, to me as an educator, is we can interact with it at our own need, at our own pace. There's lots of resources in your program. There's lots of text. And I know in the beginning members get overwhelmed, but you take what you need in the moment and you cycle back. And next time you do the program, if you've still got weight you want to lose, something will speak to you differently.
What do you want people to know about being successful on the Livy Method? From everything you've studied and you've learned, like, what's the secret sauce? Obviously, learning, practicing is really huge, especially how that factors into being able to maintain your weight. And I want to talk about that as well. But specifically for weight loss, what can you share with our members that is going to help them be successful?
Every session, the average weight loss is about between 11 and 13 pounds. So basically a pound a week. The gold standard for weight loss research is, can you lose 5% of your body weight over 6 months? So that's what's called clinically significant weight loss in the obesity research. 74% of people lost more than 5% consistently every survey. Always above 95% of the people who were there at the end and answered the survey lost weight. Now, you can say as a researcher, well, of course, they answered the survey, one, because they were still there at week 12, and two, because they lost weight. If they didn't lose weight, they wouldn't answer the survey. But no, there were people who answered the survey who didn't lose weight. Often they put in their notes, this is my second time round, or this is my fourth time round, drop the ball, super stressed, I know why I didn't lose weight. So they often make that comment. There are some people who don't lose weight, but it's a very small minority. What we found was, if you're there in week 12, you've got a huge probability of losing weight. And so if you continue to follow and show up, 97% of the people report weight loss, and many of them, like in 70% and above, consistently over those 6 programs had clinically significant weight loss. And people had more than that, like they had 10% of their body weight, which is really, really remarkable, to be honest.
Those are huge numbers. I also just want to indulge in what Ruth was talking about. So the gold standard of weight loss is 5% lost in 6 months. People are seeing that in 3 months of the Livy Method. So the program works. The conversations that we've been having about weight loss in the last few years, people are just having, they're just starting to have. No one is talking about maintenance in the way that we talk about maintenance in the maintenance group. It's such a big conversation. So a couple of things I want to know about maintenance. So why do people gain their weight back? Because you've talked to people who've gained their weight back. So how do people not, like, what's your perspective on that? Why do people gain weight back? How do they feel about that when they're, from the conversations you've had?
The people I spoke with who had put weight back on, they all understood why, which is an
Yes.
enormous step forward. So they understood what they'd done to lose the weight. They were annoyed. They were pretty
Sure.
cross with themselves for putting it back on. But if they took a minute and reflected, as we did in the focus groups, they could recognize why they'd put it back on. And so that is good to know. And it does resonate with what the research says. The people who had kept it off basically said, well, I live differently. I have a new identity to what I used to be. I'm still the same person. I'm still Ruth, but I don't identify as somebody who's trying to lose weight. I'm no longer a dieter. What I am is I'm Ruth. I'm active. I go to the gym most mornings. I move my body. I enjoy every single morning. I get up well before my partner. We've got a different sleep schedule. He stays up late. I go to bed early. And I sit outside on a rock and have my cup of tea or cup of coffee. And I just sit there, usually listening to podcasts, but sometimes not even doing that. Every woman I spoke to, and there were mainly women on the focus groups, who had successfully maintained their weight loss for over 2 years, spoke like that. I live a different life than I used to.
When we talk about with Dr. Beverly, for example, or even Dr. Dina about learning, unlearning, relearning, learning new things, or who am I? Or we talk about visualizing who you want to be, that person who loses that weight. What does that feel like? What does that look like? What is your day as that person? What does that look like? Like the Ruth, for example, old Ruth, get up, go to her computer, work all day, do whatever, drink coffee, not eat nutrient rich, versus the 70-pound lost Ruth now who has a totally different routine. It's not the food. It's not, yes, the food, like what to eat, when, the food plan, all of that. Of course, the guidelines, try not to go too long without eating. All of that is so important. But that is not like this is why you get A-type people who are like, oh, just follow the guidelines. Done. Lost my weight. Follow the guidelines. But for most people, it's all the rest of it. It's needing that support. It's when life is smacking them in the face. It's working through their issues, associations, feeling like they're not alone, feeling like there are people there to support them. It's the social part. It's the learning part. It's all the rest of it. That's what the diet industry has not been talking about. They don't talk about it in relation to dieting, weight loss. They don't talk about it when it comes to maintenance. And this, I believe, is the secret sauce to the Levy Method. I know there's a lot of working parts. The method itself, I know it's me, the resources, our guests, our community, but really it's everything else. You are not going to find the secret sauce to sustainable, maintainable weight loss through the food plan, through what you are eating and when. That is not it. That is not it. And this is why it's like so much bigger than just losing the weight. And this is why I hope this conversation brings you the appreciation to understand all of the work that you're doing and why it fits in.